This is QD Clinic. QD Clinic is brought to you by RoomNow.live, and I'm Jack Cush from RoomNow.com. Today's episode, Self-Medicating Myself. And no, we're not talking about candy, booze, or shopping. Self-medicating seems like a problem, don't you think? I just recently had two patients. One said to me, hey, where did this prescription for tramadol come from? She said, well, I'm taking my dog's tramadol. It seems to work fine. I've had other patients say I'm taking my dog's Rimadyl or my dog's Meloxicam. You know, they sometimes have the same medicines as we do. Another good one is I'm taking my husband's Trazodone. Another great one is I went back and took that gout medicine that was prescribed for me back in 1995. Yes, it's been in the drawer for over 15 years. Actually, that would be over 25 years. And then there's stories like this. A patient of mine gets admitted to the hospital, has a pulmonary embolism. She has chest pain, shortness of breath, ankle edema. We prove PE. We put her on anticoagulant. She goes home on Coumadin. She has rheumatoid arthritis. She's told to not take any naproxen or Motrin or any anti-inflammatory medicines, but continue your other RA medicine. She goes home and does well, comes back in 3 weeks later, sudden severe chest pain, shortness of breath again. Is this another PE? No, it's not. Oh, she dies. And she dies from pericardial tamponade. Why does she have pericardial tamponade? RA, and she's taking Advil along with her Coumadin, and she bleeds into her heart and dies. So self-medicating is a bit of a problem for you and for the patient. The question is, why does someone self-medicate as opposed to seek the advice of a doctor? Maybe they don't have a doctor. Maybe they have a severe independent streak that is driven by their distrust of doctors. It's a bit of a problem. Some patients, it's an access issue. They really don't have resources and accesses. Some people, it is a financial issue. Sometimes it's very important to find out, why did you do that? Because when you're faced with a patient telling you, I'm taking my dog's medicine or my husband's medicine, or I flew to Mexico to get medicine from a pharmacist because I didn't have to see a doctor then. You want to find out why they're doing that as opposed to asking you, the person who's supposed to know. So I think it's a bit of a problem. I think that you need to consider that someone who is self-medicating themselves may be self-diagnosing themselves, and that self-medication is a surrogate for that. And self-diagnosis and self-medication, quite dangerous. It can lead to delays in care. It certainly is an avoidable risk, but a risk nonetheless that they are taking. You know, a lot of patients who self-medicate also have problems with addiction, or maybe the converse is true. Patients who have a problem with addiction are often guilty of self-medicating. We also know that it adds to polypharmacy. And lastly, you know who's really guilty of self-medicating? That's right, it's you, physicians and medical students who think, well, I'm just too busy to go to the doctor. I might as well just write myself a prescription for, and whatnot. Pharmacies usually have a rule against this, especially if you're writing for drugs that you shouldn't be taking without a doctor's advice. But again, this is a gigantic problem. I think the question is, how are you going to respond to it? I tend to go ballistic and overboard, and that doesn't teach anybody anything. I think you shouldn't do what I do. I think you should probably grab your head, shake your head, squint your eyes, make it look painful, like, oh my God, I wish you hadn't done that. And they're going to say, why? And you say, for the reasons I just said. It's dangerous. It's like, rolling the dice. Know that when I prescribe a drug, the safety of that drug has 4 built-in mechanisms for your safety. 1, I know what I'm doing. I know that I can give you this drug along with those other drugs, and I have a list of everything that you're taking, I think. The other way is the program I'm using, my EMR, is also checking for drug interactions. Thirdly, the nurse who checks you out, or the nurse who takes your phone call about your medicines, she's always checking for interactions and drugs that you should and should not be taking. And lastly, the pharmacy, where you fill a prescription, they're supposed to be checking, at least their computers are checking. So getting a prescription written by a doctor who's invested in your health and well-being is probably the message that you want to give. And you probably want to say, please, don't kill yourself. Please ask me for what you should take, and I'll certainly tell you. That's today's case. Remember, RoomNow.live, you can register. Our first day begins with a lecture by Roy Fleischman talking about the newest of therapies in rheumatoid arthritis. Maya Book from Leeds in the UK, a killer session on difficult RA. She's been working on this with EULAR. Maya is a fabulous lecturer. And then Alan Matsumoto is going to talk about the recent advances and paradigms with EULAR guidelines and ACR guidelines. And then all of those three are going to get together and take your questions about RA. We're going to end our first day Saturday with a session on RA again with Jeff Sparks from Harvard talking about ILD and RA, and I'll be talking about pneumonia and RA, the number one killer of RA patients. And then in between, we have 2 step sessions. Step sessions are like our TED Talks. In the morning, we have TED Talks from Ian McGinnis talking about lessons learned from older drugs in rheumatology, and Frank Buderet from Germany talking about glucocorticoids in RA. In the afternoon session, we're going to have 2 short TED-like talks on training, rheumatologic training and education during the time of COVID, and then an update from the Global Rheumatology Alliance Registry. That's just a few of the tidbits from this year's RoomNow.live. We'll see you there.